A promising drug to fight coronavirus, Remdesivir. The drug has helped patients in the Basin, but this week, Midland Memorial Hospital used their last dose of the drug. Big 2's Jake Eichstead spoke with Midland Memorial Hospital CMO. Jake, do they think the drug is effective?
Katie, Dr. Wilson says there is no clinical evidence yet, but from what they've seen, there is surely reason to believe so. The doctors say there is no one way to defeat the virus, but they are trying everything because it all could potentially help in its own way.
It's a moving target, but we're getting better at strategies.
One of those strategies, a 5-day dose of the antiviral drug Remdesivir. And the U.S. currently holds a majority control of the globe's supply of it until October. Midland Memorial Chief Medical Officer Dr. Wilson says they've been administering it to severe cases until they ran out of it this week.
It's a little hard to unwind that knot, and see which pieces of it are making the biggest difference. But it seems pretty universal in the view of our clinicians that are taking care of these patients that it is beneficial to use Remdesivir. Every one of these patients, they got CCP, they got Remdesivir. We're doing everything for them. Whether or not it's the reason or not, it's hard to say. But I think anecdotally, I would agree that we are favorable to the continued use of Remdesivir.
They have used convalescent plasma or plasma from recovered coronavirus patients paired with Remdesivir. The antiviral drug's purpose is to block the ability of the virus to grow and replicate.
So the target organs are the ones that get affected. So we see it in our respiratory tract, we see it in our GI tract. There's receptors in other organ systems too. So we've seen neurological and vascular and other manifestations of the illness. But the Remdesivir helps prevent that from occurring.
Before, the drug company Gilead had provided the drug to the hospital for free. Now, that is not going to be the case.
I don't know how rapidly Gilead can produce the product, but I'm sure the demand for it across the country is, I'm sure you're aware, it's we're seeing more and more cases. I heard Fauci speaking this morning. We were at 41,000 cases yesterday in the United States, and he says if we continue to not listen to the words of wisdom about facial coverings and social distancing, we're going into a holiday weekend. People are likely going to be making some poor choices regarding those things.
All the more reason to stock up on the drug now, especially as hospitals continue to reach capacity. Again, no clinical evidence, but many report anecdotal evidence that it will clear up those ICU beds a little bit faster. Reporting in studio, Jake Eichstead, Big 2 News.